Lastly, we're going to be taking a look at what occurs during that delivery appointment for an indirect restoration. And for demonstration purposes for that, we're going to be using a crown as our indirect restoration. So by this point, the patient has been in a provisional or temporary crown anywhere from 2 to 3 weeks. We bring them back, we seat them, we update medical history, medications, and we take vitals. Again, it's going to vary office to office on what the protocol is in regards to that, but at the very least, updating medical history should be done at every single appointment. Doesn't matter if we saw them yesterday, if we saw them this morning, we always want to make sure that we're asking that question. So what occurs? Well, and before I go on with that, one more thing I do want to stress is to make sure that you are checking to make sure that the lab case is back from the lab prior to the patient coming in for their appointment. The last thing you want to do is have the patient come in for their appointment only to find out that the lab case is not back. Nothing irritates the dentist more or the patient because they oftentimes have taken time off of work to come in for this appointment. And if we're not going to be able to do anything, that's time that they've wasted. That's time that we've wasted in our schedule as well because we're not able to do anything. But not only that, but the patient is going to have to try to find another day within the next couple days or week to be able to come back for us to permanently put in their restoration. So again, always make sure that you're checking ahead of time. Always look at your schedule for the day before to find out who's going to be coming in and if any lab cases are going to be needed. If that's going to mean appliances like partials, dentures, crowns, bridges, veneers, whatever it is, if it's being made in the lab, you need to make sure that you're checking to verify that it's in office before the patient comes in. If not, that gives you a chance to go back to the copy of the lab slip because the lab slip will have a copy underneath it. You keep one, you put in the records, and one gets sent to the lab with the lab case. But you are able to look at that to see what due date you put on there. If it's the day, if the due date is past, then you need to make sure you're on the phone calling the lab to find out what's going on with the case. Oftentimes it's either been delivered to some other office, it hasn't been completed yet, but we need to know what's going on with the case so that we can communicate that with the patient prior to them coming in for their appointment. Patients are much more inclined and happier to know that their appointment has been canceled, even if it's the day before, rather than them showing up to the appointment and not having their permanent restoration like they thought they were. So just always make sure that you're checking your lab cases to ensure that they are in office. Once a patient is in, this may be your job and responsibility. It may depend on your dentist, but they might delegate for you to remove the temporary or provisional crown. Again, it's something that you may not be doing right away. Once you are a little bit more familiar with it, you're a little bit more proficient with your skills, then that is certainly something that the dentist may delegate for you to do. What can be used to remove a provisional or temporary crown? Well, there's a few different types of instruments that can be used. A spoon excavator is one. You do have to be careful as you're using that spoon excavator and pushing up on the tooth that you're not damaging or injuring the tissue. So one thing that I would recommend, especially starting out, would be to use a curved hemostat. And that is something we use all of the time. Usually with that curved hemostat, we would just kind of wiggle the tooth off and it would pop right off. The temporary cement holds it in place like it should, but it's actually very easy for it to be removed. Or special instruments like a crown remover can also be used. Looks very similar to a plier. So whatever your office has as far as instruments to be able to use, those are things that you can definitely use to remove a provisional crown. Also making sure that the cement, any excess cement, has been removed off of the tooth underneath the gum tissue. Again, we don't want to leave any of that cement in place because it can irritate the tissue and it can lead to problems down the road. So at that point, if the dentist is not already in the room, then you're going to get the dentist. He or she will come in. They will take the lab case and they will begin to try in the crown, the restoration. And usually how the lab will send back the lab case is it's going to be poured up in stone. And this was done using the triple tray. And if you remember, the triple tray was the universal one that you could do for both left and right. And it was able to take both upper and lower. It had that mesh in between it. Well, from that final impression, they were able to pour it up in stone, just like this. And they also create something that's called a die. And a die is basically an exact replica of the prepared tooth. And remember, we did both, we did a bite registration. You typically will take two. You take one prior to the tooth being prepared, and then you take one with the tooth prepared. And this is one that's showing you of the die itself, what the bite registration would look like. And this again just helps to, when they're articulating the model together, just to make sure to see how the patient bites together. So as they're fabricating the crown, they know that it can fit, they want it to fit well. There might be some adjusting that still has to take place occlusally and interproximally, but they try to do it as minimal as possible. The crown will typically come in some sort of a case or box, very similar to this. The crown fits very nicely inside there. And again, the dentist will oftentimes remove it, the crown, and place it onto the die to make sure that it's going to fit appropriately, that the margins look good, the fit looks good. And then what they're also going to do is they may also place it back onto the articulated model here, and then occlude it on there so they can see how it looks both interproximally and then also occlusally. And then once they do that, they try it into the mouth. And again, they make adjustments. We use the articulating paper to make sure that the patient's biting, to do any kind of markings on the crown. And if those areas are, really dark blue in color, those are areas that we want to make sure that we're adjusting, because again, we don't want the patient to be hitting very high on certain spots because they can fracture the restoration in the crown. So we want to make sure that they're occluding evenly throughout all of their teeth. And then again, once it's in place, oftentimes because it's not cemented in, you'll take an instrument and over the top, you'll hold it on the top with the instrument, and the dentist will put some floss through interproximally just to make sure that the contact is good. Or if it's too tight, if the floss isn't going through, then there's going to have to be some adjusting that takes place. And if it's too light, then oftentimes we may have to send this back to the lab to have them remake it. So once all of that is checked and it looks good, the shade looks good if we're doing a tooth-colored or porcelain, PFM, ceramic, whatever it is that's tooth-colored, we want to make sure that the shade is going to match the other teeth and that the patient is happy with the way that it looks. We always make sure that we show it to the patient prior to permanently cementing it in the mouth, because that's the person who it's going to matter. They're the one that's going to have to look at it every day. So we want to make sure that they're going to be happy with the way that it looks. So once that has been taken place, patient is okay with the way it looks, we then go ahead as the assistant, you'll mix up the material, you'll mix up the cement, you'll load the cement into the crown, oftentimes using a Hollenbeck was something that we would use to load up the crown with the cement, hand the crown to the dentist, they'll seat it, usually have the patient bite down on a cotton roll, remove any excess cement. If it's an all ceramic crown or veneer, then obviously it's going to get light cured in there and bonded in. Once that's done, they take a look at it again. They have the patient bite together with the articulating paper just to verify that everything looks okay, and also run some floss down through the interproximal contacts again to not only check the contacts again, but also to make sure that they're removing any excess cement that's in there. Once that's done, then the patient is done. They're good to go. At this appointment, typically we don't anesthetize the patient, and that's done for a reason, because if the patient is numb, it's a little bit harder for them to be able to communicate with us how it's feeling. So oftentimes, as long as the patient isn't too sensitive, because we will have to blow some air on it, we will have to rinse it out. As long as they can tolerate that, then we're good to go without any anesthetic. And again, it just helps us to get a sense for how it's feeling to the patient once the restoration is in the mouth. So once it's done, then the patient's good to go. So that is kind of the process and steps when it comes to delivering some sort of indirect restoration, and it's going to be the same. Doesn't matter if it's a bridge, if it's a veneer, if it's an inlay, it's an onlay. The process is still going to be a little bit the same.